So with that, I'm going to turn it over to David Sweat. He's going to introduce our epidemiologist. One of our critical roles is surveillance and assessment and sharing data. We call it democratizing data. One of our strengths in Shelby County is getting data out to the public so that individuals and organizations can make sound decisions. So we want you to see who those team members are, because they oftentimes are, as they said, invisible. Thank you.
So good afternoon, and as you can see, assembling behind us are the data team from the COVID response unit in the Shelby County Health Department. And I want to particularly recognize them because they've done yeoman work for months now in some cases, and some people are brand new to joining us. But all of the data visualizations that occur on the Shelby County website, all of the resourcing for numbers and information that we bring to you every time we come for a media briefing, that the mayors share with you, they come from this group of people behind us. And so I want to call them out individually and introduce them. Jennifer Komet, raise your hand, please. Jennifer is one of our deputy administrators, senior epidemiologist previously with the health department, been with us for many years, and she's been active in the data program ever since March the 7th. Also, Chaitra Subramanya, if you can wave, Chaitra. She's one of our, yeah, there she is. So she's one of our epidemiologists that had been with us before and is transferred from the Office of Epidemiology into the COVID response unit to stay with it. And she's been responsible for a lot of the data analysis and the data visualizations over the past several months, going back to March. And we thank her for all of that work. And then we have three new people who have joined us. I'll mention first Jessie Smith. Go ahead and introduce yourself there. So Jessie has been working with us before as part of the ESF8 data subcommittee for the Joint Task Force in a volunteer capacity, but now is a epidemiologist with the health department and helping us with modeling and looking at the impact of the future impact of the COVID epidemic, as well as backing up Chaitra with the data visualizations on a regular basis. We also have Faisal Mohammed. Faisal, you want to make yourself visible? Faisal is our surveillance epidemiologist, and so he's responsible for coordinating all of the surveillance of cases and making sure that we're coordinated with the Tennessee Department of Health and classifying cases correctly and assigning them to the contact tracers to be worked, and that's an important set of responsibilities. And then Umar Kabir is with us. He is an epidemiologist and a PhD candidate at the University of Memphis, who has joined our team specifically to work on outbreaks and cluster investigations. So that is the data team behind the scenes that's generating all of this data for us and the analysis that supports our work. And we thank them very much for their efforts. I also do want to remind people that we do have some vacancies still in the COVID response unit and some new part-time positions that will soon be posted for people, but we have 25 currently open jobs, at least as of last Thursday, in a variety of places, either health investigation, environmentalist inspection, public health nurse, medical technologists, clerical specialists, and public health coordinator roles. And so anybody who's interested in joining the COVID response unit in any of those capacities, please be watching the Shelby County Jobs portal and applying for those positions for which you have an interest. And some of the vacancies have also been created since the unit opened because people have found non-durational employment or have been promoted within the team to new roles, creating a prior vacancy. So we're still trying to flesh out our full team and add to it to continue the work of responding to the COVID epidemic, protecting our vulnerable populations, investigating cases, and protecting the citizens of Shelby County. So with that, I'll turn it over to Dr. Randolph, our local health officer.